Concussion is a lifelong problem if you have a problem with it. That's the thing, is it's not just that I had a concussion and I'm over it and no big deal anymore. It's that when you have a concussion, the second impact syndrome, so if you go back to play, if you really don't take that time to heal, all that kind of stuff, there's inflammation and swelling around the brain, and it's in this tiny box. You know, the brain box, that the skull is the brain box, and it just is not, it's not forgiving.
Right.
There's no extra space. And so when it swells, the only thing that can give way is the brain. And so if that isn't allowed to completely heal, and then you get another problem, you have long-term brain changes. And so it's not so much even that you're going to notice like just today, but when we talk about the NFL and we talk about all this stuff, I mean, it is permanent personality changes. It is permanent memory loss. It is, really life-changing inability to function when you talk about multiple brain traumas.
Right.
So
now, some of the things that you think about, obviously, you don't have to be knocked out.
No.
To get
that
a concussion.
was the old, like, it's no big deal unless you're knocked out. No, that's not true. Of course, when you are knocked out, it's like the brain is like reset. You know, it's like hitting that button on the computer. Like, nope, we're done. We're stopping right now. we're gonna try again. And it can be for a very short period of time. I mean, it could be that literally somebody was knocked out and woke back up before they even hit the ground.
Right.
But it can still be that traumatic and that much of a shut off. And it's the same thing that happens in like a whiplash accident and an auto accident and things like that.
You can get a concussion from a whiplash accident?
Absolutely.
Because that was one of my questions as well, is you don't necessarily have to have an impact to the head. Do you?
It's the change in velocity and direction of the brain inside the skull. And so if you are, let's say you've got your seatbelt on, and you're on this head-on impact, and the seatbelt stops you, and so you move forward so quickly that the stopping forces the brain into the front of the skull.
Right.
The same thing can happen. Typically, in war, when we see a lot of this kind of stuff, concussive force from a bomb blast.
Right.
From that kind of stuff. So you don't see the force, but it's a concussive force. And so it has the same, and that is called an MTBI. It's a minor brain traumatic injury. So, it's still a concussion, and it still has the same effects.
Right. Now, if you take a hit like that, different individuals are going to react differently to that. Do the effects and the symptoms hit you immediately?
Not always.
Yeah.
A lot of times you will see that. You'll see the confusion right away. You'll see the loss of memory right away. They may not know who the president is today. They might not, be able to remember 3 things in a row right away. But no, the worst concussions come on later. Like, you don't see the symptoms right then. But actually, that is a difference, because that is a brain bleed. Like, when they talk about, you had a concussion and you keep your kid up all night and that kind of thing.
Yeah.
It's not so much it's keeping them up. It's that when things start to happen, you can be talking and everything's fine, and the brain changes so quickly because it can handle this much, but then you get just that next little bit over, and now it can't. And so that is a brain bleed. So that is, you've had an impact, and you weren't really, you had your bell rung. You're not feeling so good, especially if you're nauseous, all these other kinds of things. But there's very, very tiny vessels in the brain, and it's very vascular. I mean, we want to feed the brain. We want to give it all the nutrients and all the energy and all the stuff. So there's a lot of blood flow going to the brain. And so tiny, tiny capillaries, if any of those tear or break, then you can have the blood that's released into the capsule and into that area, and blood itself is toxic to the brain. And so, you don't actually want it touching the brain because it damages it. But then also the thing is, then that small amount of blood continues to get bigger, and it's a space-occupying lesion, and it gets bigger, and then that's where they want you to keep checking on someone to see is their function still good?
Right.
You know,
right.
is their function changed?
Right.
Because that's what you're looking for. It's not just to keep them up. You know,
right.
Because
that's not going to necessarily cure them
no,
by
not
staying
at all.
awake. You just need to follow them to see if
it's just
if
that you can't evaluate them if they're asleep.
yeah.
That's pretty much it.
Not those things. So now you'd mentioned different levels of concussions. There are different grades. Is that what it is?
Yeah, they've got a new grading system that they've been using for a while now, and so it at least is identifying a little bit between, just a very mild concussion. And again, you still need to be cleared for all these if you are involved in sports. I mean, you just can't be on saying like, oh yeah, coach, I'm good.
Right.
Everything's fine.
Right.
Don't worry about it. It's like you really need to be evaluated at different levels.
Right.
Because
right. And coaches, of course, and parents need to be more aware of that as well. We all want our kids to be tough. We all want our kids to be, the star of the game and things like that.
Sure.
So, especially in macho sports like football and things like that. But coaches are getting more education on that. And,
right.
I know that in hockey they take them to a quiet room. Now, I don't exactly know what the quiet room exactly means, but I guess it just takes away all the other stimulation so that the focus can be on the individual.
Well, yeah, your evaluation's much clearer when there's not so many distractions.
Right.
Because obviously, if the kid's involved in the game and then they're asking them questions or they're asked to remember things, they may just be distracted.
Right.
You may not be getting a clear evaluation and that kind of stuff. So on that side, you're actually erring on the side of caution, and you would keep them out maybe longer than they actually needed to be, and stuff. So and also, one of the treatments for concussion is reduced stimulus, and so really don't be watching TV, trying to study, doing all these things. It is letting the brain rest,
right,
and stuff. So that's when you really want to see much more quiet. You don't want them on there texting 24/7, all this kind of stuff. It's really kind of shutting down and resting your brain just as you would rest a muscle, or if you had a muscle tear or a pull or something like that. Obviously, when you have a break, you cast it because you don't want it to move. Mm-hmm. So that's what we want the brain to actually just be given a break.
So that's one of the treatments, obviously, for concussion. What are some of the other things that?
Time because the swelling has to go away and that kind of thing.
Right.
I mean, and in extreme cases, obviously, where they were hospitalized and that kind of thing. I mean, if there is huge swelling, they may actually have to drill a hole in the skull because they got to relieve the pressure.
Right.
Because if you don't, again, it's compressing the brain, and so it's going to damage that segment, and so it is just really, it's such a huge variety of treatment. But what you're mostly going to see is, again, not being able to get hit again, because whereas that second impact syndrome is where more damage is going to, and it doesn't take very much impact. That's the other thing, is where when you think of the first time around, it maybe took an extreme amount of force to give you that first concussion, but the second one, it doesn't take anywhere near that kind of force. And it also depends on how you're hit, because is it straight on? I mean, you're thickest right here. The skull is thickest there. And so then if you're hit from the side, you really are going to it's going to be a lot more problematic if you're hit from the side. And because it's just set up, it's tethered in a way that front to back is the most common way we would be hit.
Right.
And so side to side is going to have, and your skull is very, very thin, especially at the temporal region. And so that's why you'll see, in martial arts movies, that's where they hit them and things like that. But, that's
something to remember if you're defending yourself against somebody. Now, one of the things, a startling statistic, you wrote this for SheKC, it was in the springtime, I think, is that females are a higher risk of concussion in sports than boys are or men are. What is the reason for that?
Well, they aren't 100% sure. One, they think it may have to do with the strength of the neck muscles, being able to hold it in to keep your head off the ground, in an impact where you'd be going down. Guys just have much bigger muscles there, and that kind of thing. The skull is thicker, truly in men. It's thicker, but really they were looking at the increased amount in women, and they really think it may have to do with the strength of the neck muscle.
Okay.
So
Yeah.
preconditioning is always going to be your best defense.
So how does chiropractic help with concussion issues? I mean, obviously, quieting everything down and things like that. But
when you have the nervous system is facilitated, which is excited, it's overstimulated because you got too much going in.
Right.
I mean, chiropractic is great for all the resultant effects because usually you're going to have a whiplash with it. Usually you're going to have other things going on.
I see.
I mean, the concussion is truly a lot of time. Your fish oils, that kind of thing, are going to truly help. So there's a lot of nutritional treatment that can be done to help. Depending again upon the severity, because if you're in the hospital and you have to drill a hole in your skull, I'm not going to really help you. But it is one of those things that the evaluation for any doctor, you really, after those impacts, after that participation, you want them evaluated by a doctor.
For sure. And really, before they return to the game,
yes, before they return to play,
it's really important that they get reevaluated and they get a doctor's okay. And if they don't feel right, even after the doctor's okay, the doctor's not going to give them okay if they don't feel right anyway. So he's going to say let's talk in 2 weeks or something like that anyway.
But usually there's so many other injuries that we are assisting with, and and so pain is going to be definitely something we're going to help with, and realigning everything so that when you do have healing, that the healing is proper.
Right. Now there are other measures that you can take to prevent concussions. And you outlined some of those in
I always think
article.
the number one is the mouth guard, because this uppercut is the new thing that when they talk about it in a box or a glass jaw, a lot of people, that uppercut action, because really that it's a distraction from the spinal cord.
Right.
And so it's a very different injury than most people would have occur. And so it's just very dangerous.
So the mouth guard, and I know there are better mouth guards that are out there than others that actually do the job better. But what does the mouth guard do when you get, that? Well, I get a lot of pictures from the Chiefs games.
Yes.
And I look at the guys that are getting blocked, the guys that are rushing the quarterback, and they're always getting hit.
Right
here, right underneath, pushing their heads back. And I know there are linemen that also will wear the collar in the back to keep their probably more for the whiplash type of thing.
Well, there's a cowboy collar thing that's called. It comes around again, not allowing for as much extension, especially in your front line, your center, that kind of thing.
Right.
When you have this uppercut action, a lot of it's jamming the temporomandibular joint, the TMJ. So it's the jaw, and I forgot how many thousands of nerve connections right there. And so it's actually forcing the jaw into the skull. And so you're getting a lot of it, the distraction of the brain bouncing up and then back down. For the concussion part of it, the other part of that is just it's such a damage and such an abuse, again, on the jaw, and the jaw going into the skull because it's attached to the skull.
And then with helmets and things like that, you've got to put it on and twist it and things like that.
You want to make sure it's tight enough.
It doesn't.
Yeah, that it doesn't twist. Just having anything on is not really the deal. That's they have the new guards the new helmets with the air that fills it up so that it doesn't move.
Right.
So that you can't just go up and down because it's most dangerous when it comes off.
Right.
And so then now you're completely exposed. There's a lot of improvements in the new equipment. I mean, the materials are stronger, the fit is better, all that kind of stuff. I don't know how when you got the guys with all the hair, how that's working because it's
because that's a natural thing to make it slide.
Yeah, absolutely.
It's harder to tighten it. Yeah, for sure. And that I'm sure is very tough, and parents should pay attention to that. It's real tough, especially if your kid's changing in size.
Sure.
And may change even over a season.
Well, and
it's very tough to keep it tight. I mean, I know bicycle helmets were always difficult to try and get them fitted properly to my kids.
Yes.
That was on me probably, but a hockey helmet, a football helmet, any kind of thing like that. It has you probably have to look at it every single game.
Well, and that's where the air ones are really good because you can change that.
Right.
Because the foam pad and that it's pretty much standard when it's fit, and that's going to stay there. Now, like your bike helmet's got more adjustable straps and everything. The other helmet, it really does have to fit a lot snugger, and that kind of thing.
Right. So we're going to hear more about concussions.
Always a problem.
Yeah.
It's always a problem in almost every sport, any collision sport.
And I know that there are some of those sports like soccer that are starting to add helmets to the game. I've got a person that is a friend who's a soccer coach who is a very strong proponent of that.
Of those new helmets?
Yeah, they're just a soft, kind of a soft helmet.
Right. Well, it's for headers. It's for the impact for heading the ball, but they have to relearn to use it.
Right.
And so if you start them, if we start starting kids younger so that that's how they learn to head, that won't be such a problem.
And I think there's a high school where they've turned and they're going to start, all the players are going to start wearing it. And especially the goalies, because I guess the goalie's diving out there and he can get kicked in the head, or she can get kicked in the head as well. So that's really important.
And impact with the ground.
Yeah.
Whenever you're diving, there's always that impact with the ground possibility.